Well, good afternoon, everybody, and this is your Mayor's Minute. It is Tuesday, April 14, 2020. Today, we're going to talk a little bit about cases in communities, cases of COVID-19. You know that COVID-19 has been confirmed in more than 60 congregate care facilities in Minnesota, according to the Minnesota Department of Health. And for those of you that don't know what a congregate care facility is, those are those facilities that include long-term care, assisted living, nursing, and group homes. Of course, we've got some of those in Edina. We're going to talk about that momentarily. We've had some cases come up in Edina. Since last week, and prior to that, of course, the MDH was just releasing information on a countywide basis. But starting last week, MDH began releasing the names of facilities with at least one COVID-19 case. So the state standard for an outbreak of COVID-19 inside a congregate care facility is very narrow. Just one case in a resident, a healthcare worker, or a contractor will cause the folks at MDH to designate that as a facility where there is an outbreak. Since we've got a handful of Edina facilities on the list, some of our residents have asked us what the city's doing to ensure that the people living in those facilities don't leave those facilities and expose others. And of course, the answer is that unless they have been placed under quarantine for infection or exposure, it is not illegal for residents to leave their homes as long as they are in compliance with the governor's stay-at-home order. It is, however, unlawful to discriminate against people who are not in that position where they're under quarantine. MDH licenses congregate care facilities and advises management of these facilities how to operate them when there is an outbreak. Among other things, MDH handles all the contact tracing, makes recommendations for isolation when appropriate, and explains proper cleaning and sanitizing procedures for those facilities. Right now, the congregate care facilities in Minnesota have less than 15% of all the COVID-19 cases in the state. I know that might be an unusual percentage. You think that most of the cases, or some people think most of the cases, are in congregate care facilities, but actually less than 15% of the cases are in those facilities in the state of Minnesota. More than 70% of our cases in the state of Minnesota are in private residences. You know, for several weeks now, MDH has told the public to assume the virus is in every community and act accordingly, practicing good hygiene, social distancing, and staying at home when you're sick. If you assume the virus is everywhere, and if we all assume the virus is everywhere, it shouldn't matter where the latest patient lives, whether they're living in their private residence or they're living in a congregate care facility. You know, we might still be a few months away from the peak of the disease in our community and in our state, but we must continue during this period of time to support each other, not second guess our public health officials. And no matter where we live in Edina, we'll probably see more cases, but let's stick with this. Let's stay together. Let's hang together on this, and we're going to get through this together. So make sure you wash your hands, stay socially distanced from each other, be careful about going out, stay close to home. It's not the easiest thing to do, but we're going to be better off in the long run. This is Jim Hovland, and this is your Mayor's Minute, and stay healthy. And remember what Amelia says, be strong, stay strong. Thank you.